Colleagues, I'd now like to introduce you to Mr. Robin Moore, who's the North Queensland Primary Health Network Chief Executive. He's had more than 35 years' experience in the health sector, in the tertiary acute care sector, primary health, and in mental health. He started his career as a registered nurse and moved on to senior positions at Flinders Medical Centre and Noarlunga Health Services in Adelaide, before taking on the role of Chief Operating Officer at Cairns and Hinterland Hospital and Health Service. So Robin, can I turn over to you? Thank you very much.
Thank you, George. I'd just like to thank the Minister for taking time out of what is always a very busy schedule to open this historic conference today. And as the Minister said, I think a key important issue is that to make health better, we've got to work more collaboratively between acute health care and primary health care. And I think only through the joining of those services to a view of a one health system can we really overcome the hurdles that we are currently facing. I'd also like to thank George and Trent for their opening remarks, and thank you to everyone involved in organising this event. Firstly though, I'd very much like to acknowledge and pay respect to the traditional owners on whose land we meet today, and pay respect to their cultures, their ancestors, and to all elders past, present and future. Being able to hold this conference towards the end of a very busy NAIDOC week brings a real focus to one of the PHN's important goals, and that is closing the gap, which aims to reduce Indigenous disadvantage with respect to life expectancy for our Aboriginal and Torres Strait Islander community. As the role of the CEO for the PHN, it's already provided me with great opportunities to connect with our Aboriginal and Torres Strait Islander people. Just one memorable experience that I'd like to touch on was to attend just recently the Indigenous Art Awards on Thursday Island, which gave me an opportunity to experience both traditional dancing and also traditional art, which I'd have to say was unbelievable in the diversity that was presented. It also introduced me to some traditional food as well, which I also very much enjoyed. But it gave me a significant connection to country, which I think is very important to understand the needs of our community at the grassroots level. I'd now also like to convey a special thank you to all of our delegates and attendees today. It's fantastic to be able to stand up here with the PHN only being 12 months old. I know the team who brought this together only had 4 months really to pull this all together. In talking to my CEO colleagues across Queensland, they said, "Are you mad? You're going through a transition from Medicare locals to PHNs and you're organising a conference. Good luck." And this is the result. Without your attendance, we wouldn't have a conference, and I'm sure you'll take away a lot from over the next 2 days. It's an honour to be able to speak to you on this special occasion, which brings world-class speakers and more than 300 attendees here together in Cairns. The theme of the conference is Connecting General Practice, as was mentioned earlier, and our board chair, Trent, has already touched on the importance. Today I'd like to give you a brief background about Northern Queensland Primary Health Network, where we've come from and what we want to do to help you and where we move to in the future. The NQPHN covers an area of Northern Queensland from south of Mackay up to the northernmost tip of the Torres Strait Islands, a distance of around 1,500 kilometres as the crow flies and over 500,000 square kilometres. This area includes Mackay, Townsville and Cairns regions, as well as remote Indigenous communities in Cape York Peninsula and the Torres Strait Islands. And it is made up of over 31 local council areas. In terms of geographical size, we're the fourth largest PHN in Australia, over 30% of Queensland, and our population is approximately 680,000 people. Our organisation, along with 30 other PHNs across Australia, is funded by the Commonwealth Department of Health and coordinates primary and preventive health care. Since our inception, on the 1st of July last year, we've just had our first birthday, we've been actively engaging with key stakeholders throughout North Queensland, including many of you in the audience here today. In this first year, we've undertaken a health needs assessment to identify where the areas of need and to utilise this information to inform our strategic plan moving forward. This will allow us to work more closely with the primary healthcare workforce, including community-based general practitioners, dentists, pharmacists, nurses and allied health practitioners. Also our hospitals and, importantly, the broader community to commission culturally appropriate services and ensure that our patients and consumers of health receive the best care possible. With the catchment of North Queensland PHN, the population has mixed health status, with pockets of high advantage that rests in stark contrast to the areas of extreme disadvantage. This is compounded by the remoteness of our region, our Aboriginal and Torres Strait Islander communities, which are spread across such vast areas, and reporting a higher incidence of chronic disease and subsequent lower life expectancy when compared with Queensland as a whole and the rest of Australia. The challenge for us at Northern Queensland is to improve the health outcomes and increase health access to the people of Northern Queensland. Queensland is our greatest need. We have staff working tirelessly, I must say, and I haven't worked with a more dedicated group of people in my over 35 years of experience in healthcare. Across our 4 offices in Mackay, Townsville, Cairns and on Thursday Island, to fill the health gaps identified in our health needs assessment, which was released publicly last month and which Trent also touched on in his address earlier. This includes significant national programs going into this financial year, such as mental health, after hours, aged care, and also being one of the implementation sites for the My Health Record rollout. We also have funding for programs around drug and alcohol treatment, and we use an established commissioning framework to ensure successful delivery of these services by our providers. Aside from this, we have a dedicated workforce development and practice support teams providing education events to health professionals across our footprint. The PHN is also especially committed to addressing Aboriginal and Torres Strait Islander health inequity, and one of our key achievements in our first year has been establishing an Aboriginal Medical Service Advisory Group. We're aware we face a range of challenges that we want to tackle head-on with our stakeholders. For example, we live in one of the most diverse environments in Australia, from the savannah to the tropics. We have the tyranny of distance, remoteness and isolation. We have, unfortunately, suicide rates that are 8 times the national average. The story of health generally across all of Queensland is also challenging. We have higher rates of potentially avoidable deaths and hospitalisation. We have higher mortality rates from cancer, coronary heart disease, diabetes, mental health conditions and injury. And we have higher proportions of Aboriginal and Torres Strait Islander people with significantly lower life expectancy compared to the average Australian. But at the PHN, we are determined to work closely with all health professionals and the community to make health better for every North Queenslander. We have good governance structures to deliver better support and connectivity to health providers. We support integrated care coordination, and we're working hard to enhance the coordination of service delivery, which I think is one of the key elements we require for better outcomes. We've also had some exciting opportunities to help Queensland North TAFE and fund them, and working in conjunction with the Torres and Cape Hospital and Health Service to increase the number of Aboriginal and Torres Strait Islander healthcare workers. And the feedback that we've had from this has been quite significant, in that we've had a consistent message to say this is probably one of the best initiatives that's happened in the Cape and Torres area for a significant number of years. We're working with all the hospital and health services on joint initiatives to better connect primary and acute care. All of this leads to the development of a one health system view. It is crucial we're connected in a coordinated way to improve health. Healthcare touches every Australian family, every Australian community, and every Australian workplace. And as such, we believe it's important that a critical focus for our organisation is towards building a one health system approach. With this concept in mind, we believe health should be considered in all areas of the government and non-government, as the health of our community is very much, I believe, a litmus test as to how well the overall social fabric of our community is working. I'd like to touch briefly on one of the examples of how we connected with providers in the community. In October last year, we partnered with Life Education to fund drug and alcohol education in secondary schools across northern Queensland. Interestingly, Life Education were looking at opportunities to be able to have a much deeper reach into rural and remote Queensland. So we helped with the costs associated with the delivery of their Face the Facts program and provided a vehicle for life education specialist educators to visit each of the schools in this region and also fund one of their FTE positions. This initiative came about in response to a growing community concern regarding binge drinking, ice and other illicit drug use, and a significant concern for our youth. Part of our role as a PHN is to identify and respond to local health priorities, and health providers tell us that ice in particular is a really significant health issue in our region. This program was strongly aimed at prevention, and if we're going to get traction in addressing ice in North Queensland, we have to start equipping our youth with the skills to make healthy choices and focus on the cause of issues and not the symptoms. This goes to the heart of our role as a PHN, which is making health better for people in our community, particularly those most at risk of poor health outcomes, and improving coordination of care to ensure people get the right care in the right place at the right time. We see this partnership with Life Education as an important investment to preventative health education, which will have a positive impact on northern Queensland communities in generations to come. We also have other areas we aim to facilitate better connectivity and connection. Northern Queensland was chosen as one of the 2 PHNs in the country to trial an automatically created My Health record for every person in the region, from Mackay and surrounding areas in the south, as I said, up to the tip of the Torres Strait Islands. Unless you are among less than 2% of the people in our catchment who chose to opt out, every person in our region now has a My Health record automatically created for them. We envisage, following this initial rollout, that the My Health record will be rolled out nationally. And we wanted to be part of this first step to be able to develop a system that met the needs of our people. The PHN is here to support GPs and other healthcare providers in getting ready for the 15th of July, where we will be able to access patients' My Health record information. Our practice support and My Health record team can visit you at your practice to train you in how to utilise the system, and we're also providing online training to get you prepared. Come and speak to us about how we can help you get ready. And we also have a stall in the exhibition, and more than happy to talk with anyone about how we can assist. This is a significant move forward in using technology to create a better health system and aligns with the patient-centric approach that the PHN wishes to follow. Our programs and commissioning opportunities provided by the PHN includes practice support, continuous quality improvement in aged care, after hours, workforce development, mental health, digital health and Indigenous health. One of our core activities is commissioning, which is the coordination, design and purchase of services at the local level to improve primary health and community services. With the initial health needs assessment for Northern Queensland now complete, we're collaborating with providers to develop the delivery of services that are needed to improve the health of our community. As a commissioning agency, we can identify local healthcare needs and service gaps and drive improvements in healthcare and ensuring that services are better tailored to meet the needs of our local communities. And what we've been able to do with the data that we've thus gathered thus far, is to be able to create infographics for each of our 31 local council areas, which gives a visual demonstration of the health footprint of the people in those local communities. I see this conference as another major step along the journey of achieving all these goals, and most importantly, building relationships. Please be assured at the PHN, we're here to remove the focus on backroom bureaucracy and concentrate instead on delivering improved access to frontline services. By working closely with healthcare providers such as yourselves, we're confident that we can deliver an effective primary healthcare system that tackles chronic disease and supports preventative health at the grassroots level. To support this, I'm really looking forward to meeting with all of you individually over this weekend to talk about how the PHN can support you. That's what we want to achieve. I'm very proud to have been able to speak to you today, and I'm sure you'll enjoy the diverse program that our team have been able to put together for you over this weekend. I'm also very much looking forward to the awards ceremony this evening, and also to the Aboriginal Torres Strait Islander Health Breakfast tomorrow morning. Again, thank you for joining us here this weekend and giving up your weekend to be here, and I hope you enjoy this experience. I'll now hand back to George, our conference chair, and thank you very much for attending our initial conference today. Thank you.